So I've done a lot of traveling over the last 20 years or so, teaching courses around the world and meeting therapists from many different countries. And many of them have asked me over the years, how can we get this kind of education on a more regular basis? Maybe they're living somewhere where there isn't a lot of access to neuro-rehab education, or maybe they've got a patient that is quite complicated and they'd like to do a consult with a more experienced therapist who might be able to help them problem solve through the clinical presentation and keep moving that patient forward in terms of their ongoing functional recovery. And so back in 2018, I started to develop an online education platform, and that is iNeuroRehab. It's always something I thought I would do more when I retire, but the COVID situation has accelerated its development because in-person education opportunities are now limited. It's not so easy to travel around the world right now, and so we've developed iNeuroRehab to be able to provide an online learning environment that therapists can access easily from anywhere. And we're doing both live webinars as well as on-demand content so that they can choose to access the education opportunities whenever they want to. So iNeuroRehab is an online education platform for therapists who are involved in neurological rehabilitation. It's so that you can access from anywhere at any time. And it was developed because, I really wished that I had that. I really wished I've had fantastic experiences, amazing experiences, learning environments. And it would have just been awesome if I could have recorded that and been able to play that back, because my learning could have gone to a deeper level. I could have taken I would have taken different things in at different times as I rewatched, as I relearned. And, the human body is complex. Movement is complex. And so being able to see the variety, have different patients, different clinical presentations, reviewing the clinical reasoning, doing lectures and incorporating the evidence base and the neurophysiology. Those are things that take time. It takes time to assimilate that information. It takes that time for that information to take that information on board. And so I always wished that that's something that I could have had. And so that's why iNeuroRehab has been developed, so that we can take learning to a different level, so that we can help our patients move differently.